Hello, everyone. I'm Natalie Kunzman, MD, and this is a quick tutorial for you moms and dads. And this is about otitis media, which is a middle ear infection. Now, why is it so common in our youngsters? Part of the problem is actually the structural nature of the jaw and the eustachian tube when we are younger, such as the jaw is not fully developed whatsoever. The face is very rounded, and the eustachian tube lies in a very horizontal fashion. But as we age and the jaw gets bigger and more developed, the eustachian tube angles downward and it helps in the aeration process much better, especially if there is some mucoid fluid there. Now, when the middle ear is frankly infected with an effusion is fluid behind the ear, but I remind everybody that that fluid is not like saline water. It is actually thick mucinous fluid, much like the mucus you would have in a sinus infection. The most common pathogens are strep pneumoniae, H. flu, and M. catarrhalis. Those are the most common because that's where they live many times commensally in the sinus tract. Now, for those of you who are observing a normal immunization schedule for your children, the Prevnar series is actually a series going after strep pneumoniae. Then there are 4 shots for Haemophilus influenza, which is one of the other bugs that's in the sinus tract. Now, we don't have an immunization for M. catarrhalis, but if you think about it, today's child theoretically is immune a little bit better than those children yesteryear for the strep and the H. flu series. However, that doesn't mean that a child can't get a middle ear infection. So the eustachian tube, which is the aerating portion, which is a muscular structure, needs to open and close with the changes in barometric pressures and change in some of the sinus and the eddy currents that are occurring for environmental and for allergenic and irritant phenomenon. So what are those things that can actually congest a eustachian tube? One of the number one things is allergies or irritants, and those are environmental. So if the body is perceiving some of these particulates in the atmosphere as troublesome, the body may have an immune response that secretes some IgE, and there is some mast cell degranulation, excess mucus that comes to the area to try to clear all of this debris out. And that eustachian tube can get somewhat cemented shut and having a lot of difficulty opening and closing. But I dare say in functional medicine, going after the root cause, there may actually be some children that are taking in a lot of dairy or gluten, which can give a lot of a similar response, especially with mucus production. So if your child is prone to a lot of these ear infections, and not all of them are bacterial based, some of them are a serous non-infectious base to an otitis media. You can try simple things such as removing gluten or removing cow's milk from your child's diet until they get old enough and that eustachian tube grows appropriately, gets a little larger, gets angled downward, and before you know it, you've taken care of the problem and got them over that particular hump. So dietary changes can help. Working with the allergenic field can help. There are some saline rinses that will keep the sinus port open as much as possible so that all that mucus debris doesn't pile up in that area. You can actually do some Valsalva techniques, and those are the simple things that you hold your nose closed and you push hard, which will get those eustachian tubes operating as best as possible. Now, what you really don't want to do is pile antibiotic after antibiotic after antibiotic and go after some effusions that may not be infectious, because there's some obvious reasons for overusing antibiotic therapy. But what I do think is quite beneficial, and I know in functional medicine, we like to try natural first, but the tympanostomy tubes, so tubes that are placed in the middle ear, are serving as a pseudo eustachian tube. In other words, it'll help keep pressure regulation in that middle ear space so the mucinous fluid will not have a tendency to build, cause that pressure, or frankly get infected. I remind people with sinus infection that mucus is a mucopolysaccharide, so the bacteria that normally live in their commensal now have a food source, and this is how one can beget the other. So many times in otitis media that is non-infectious, you can do a watch and wait scenario. You can do natural antihistamines such as quercetin and some of the herbal extracts. You can escalate to a frank antihistamine, and many times that is enough, but start implementing the saline rinses and potentially some Valsalva maneuvering. If this is recurrent and your child is now starting to observe some signs of speech and language delay, which may be coming from some hearing loss, this is when you really need to start taking action. And maybe the tympanostomy tubes are necessary. Maybe allergy testing is necessary. Maybe antibiotic therapy is necessary. And don't forget your friendly ear, nose, and throat physicians who are quite adept at this field. So hopefully this has given you somewhat of an overview of otitis media in children and what to watch for. The obvious signs of the infectious portion are severe pain, lots of swollen lymph nodes, and fevers. And this may be your indication that infection needs to be treated, but many times you don't need to go there. Okay, everyone, I am Natalie Kunzman, MD, and you can find me for the functional approach to your healthcare problems at nataliekunzmanmd.com.